I'm Dr. Stephen Cole. I'm a consultant in intensive care medicine. My role is to return the critically injured patient back to their former health wherever possible, but in a small number of cases this isn't possible despite all our best efforts. These patients are not going to survive, and it's appropriate in some cases that among the end-of-life choices that we discuss with the next of kin, organ donation is among these. Patients die in intensive care from two major sources. They either die because of cardiac death, because their heart stops and they are no longer able to circulate their blood around the body, or because the basic functions of their brain are no longer working. These are the functions that make you breathe, that make your heart pump, that control your blood pressure. These are controlled in a very small area of the brain, situated right at the back of the brain. It's a very primitive area of the brain, and if this is not functioning, you cannot live. In terms of brainstem death, which is what we're talking about here, we have a number of preconditions which have to be met before we can even think about that diagnosis. We have to have an injury which is consistent with that diagnosis, and then two consultant doctors have to do two sets of tests to confirm that that brainstem death has taken place. And these involve tests of the nerves around the face and the nerves that control breathing. For example, we would open the patient's eyes, shine a light into the patient's eyes. If you imagine someone shining a bright light into your eye, your pupil contracts, it's slightly painful. That doesn't happen in a brainstem dead patient. We take a lot of care and a lot of time to make sure that we do this at the right time in the right patient and we get it right. After the first set of brainstem death tests, I would, together with a donor transplant coordinator, go and speak to the family. We would then discuss with the family that their loved one is dead, and we would then discuss with them potential end-of-life choices, which would, of course, include organ donation. We know that most people support organ donation. We know that most people would be happy to accept an organ should they be in need of one. But if you don't make your feelings clear, if you don't tell your family and your loved ones what you want to do, then you're asking them to make that decision for you at a time when they are terribly stressed and bereaved.